Okay, so yesterday we went through and talked about the signs of tumors, didn't we?
Mm-hmm.
There were 7 of them. We did them right at the end yesterday. First one was atelectasis. Okay. What was number 2? Unilateral enlargement of a hilus, which we said could be from 2 things. Either central tumor enlarging the hilus or lymphadenopathy. Yeah, lymph spread, exactly. Big orange. So we can have it from the tumor or we can have it from lymphadenopathy. Number 3 was mediastinal widening. Mostly that's going to be small cell cancer. Because remember we said that one's classically going to originate from big bronchi. And if it came from a main stem bronchus, it isn't even going to be in the hilus. It may just widen the mediastinum. 4 dealt with the apical tumor, which Henry Pancoast described, the Pancoast tumor, and then the Pancoast syndrome, the mass in the apex, bone destruction, Horner syndrome, neck pain, and arm pain. What was number 5? Cavitation. We know tumors can cavitate. We know they tend to have thick walls, irregular inner borders usually. They may incompletely cavitate. They can mimic mycetoma. We talked about that. We also talked about the 6, which was the pneumonitis, where a tumor can either look like consolidation or the tumor causes obstructive pneumonitis by blocking the normal drainage out of a bronchus. And then the last sign, number 7, dealt with what? Probably one of the most classic signs, the unilateral localized density, yes, but the nodular type, where it's circular, oval, and well-defined. That's what we talked about. And so we actually have some examples of those things here today. So if we look at this one, what do you think about the right hilus versus the left hilus?
It's enlarged.
It's bigger, isn't it? So it's enlarged. So we have unilateral enlargement of a hilus. But if you looked closely at it, what happened to this rib? Yeah. It's got bubbly, destructive expansion, doesn't it? Do you suppose this and this have anything to do with each other?
Yes.
Yeah. So we have a central tumor, and tumors are more commonly central, and they're more commonly on the right side, aren't they? Because 60% of tumors, central or peripheral, are right-sided, 40% are left. So we're 1.5 times more likely to be on the right side. And then we've got this. We may even have some destruction in this one right here. So what is this patient's staging going to be?
4.
Yeah. This, even though it's thoracic, it's still Mets to the skeleton. That's distant Mets. That's bone Mets. This is an M1. It doesn't matter what the T and the N is. This is an automatic M1. All M1s are stage 4. Stage 4s have less than 10% 5-year survival. This is probably at best 7-8% 5-year survival rate. It's not very good. And this could be the first film. The patient may come in complaining about upper back pain. They may say, I hurt up here. This is where it's just killing me. It's getting worse and worse. That may be the presenting, films for the case. Rib destruction. So it's a central tumor. So which tumors are classically central?
Bronchogenic.
Squamous is central. Small cell is central. Adeno can be central. Large cells, classically peripheral. Adenos are more commonly peripheral. Squamous can be either. Small cells classically central. So we just think, all right, well, which ones are central? Well, it could be squamous. Might be adeno. Could be small cell. Large cell, no. Bronchiolar, doesn't look like this. Bronchial adenoma, they're usually smaller bronchi. They're usually away from the hilus. Doesn't mean they're out at the chest wall, but they're usually away from the hilus, and usually mild symptoms. And of course have nothing to do with smoking. So this is probably going to be squamous, small cell, might be an adeno. That would typically be the way we'd look at it. Okay? What happened here? I don't know if it even gives us the cell type on this, let's see if it does. It just says bronchogenic carcinoma, Mets to the 4th and 5th ribs. Bronchogenic, so that doesn't give us cell type. But that's the thought process for the cell type. All right, so what do we think of this one? Well, look at in the upper lung on the PA view. So we have opacification of the apex on the left side. Everybody see that? Very opaque, isn't it?
Yes.
Very opaque. Good. In fact, there is a bone film here. Let's just put that on.
Yeah, nice.
All right, so trachea displaced,
Yeah. Uh-huh.
Yeah,
and which way is it going?
away from the density.
Away, so what does that mean? Being pushed. Something's getting bigger and it's pushing the trachea out of the way. So we have a mass in the apex. What's happened to the first rib?
Pushed up.
Destruction.
It's destroyed. Look at over here. We've got osteolytic destruction in that rib. It's just destroying the rib because this has spread into the rib cage. It's expanding, it's pushing this. If it's pushing the trachea, could it compress the esophagus? So they may be complaining of swallowing issues, dysphagia. We have a mass in the apex.
Is the TP also affected?
Could be. Yeah, probably not. Looks like the cortical margin's intact, but definitely it's spread into the rib. So we got mass in the apex, bone destruction. They could have neck and arm pain. And it's even on the less common side, isn't it? It's on the left side rather than on the right side. Yeah. Henry Pancoast described this. That's the Pancoast tumor. So cell type, it's more commonly squamous. Could be an adeno. Really could be any of the peripheral tumors, any of the peripheral bronchogenic. But it's more likely to be squamous. Small cell? No. Small cells are not peripheral. They're always big bronchi. This is not a big bronchus. There's no big bronchi up here. So it didn't originate in the large bronchus. It's a very small airway. And it's right out near the apex, and it just grows upward through the pleura. So if it went through the pleura into bone, it's a T4 cancer in terms of the staging of it, isn't it? And it's spread into bone, which is direct extension metastasis. So it's a T4, it could be a T4N0M1. Bad prognosis, huh? It's not a good prognosis. Pancoast tumor may or may